Hello, everyone. Welcome to our today's discussion titled The Impact of COVID-19 on Canada's Foreign Policy. My name is Bijan Ahmadi, and I'm the Executive Director at the Institute for Peace and Diplomacy. Before I introduce our moderator and we start the panel discussion, let me briefly talk about our institute. The Institute for Peace and Diplomacy is a Canadian nonprofit and nonpartisan foreign policy think tank dedicated to promoting sustainable peace through diplomacy, dialogue, and constructive engagement. Through its publications, conferences, policy briefings, and recommendations, IPD will encourage policymakers and leaders in government, civil society, and business community to adopt a more restrained, nuanced, and open-minded approach in managing the strategic challenges and geopolitical risks of the 21st century. The discussion today is the third panel we are hosting in our series about the impact of COVID-19 on international peace and security. If you would like to watch the previous discussions that we hosted in this series, please go to our website. The video recording of this discussion will be published on our website in the next few days as well. Our website is www.peacediplomacy.org. Now, let me introduce our wonderful moderator for today's discussion. Catherine Clark is a nationally respected broadcaster, MC, and the president of Catherine Clark Communications, providing strategic communications advice to individuals, institutions, and corporations. Catherine is co-founder of The Honest Talk, a popular new podcast featuring frank discussions with notable women. She writes the Giving Back column for Ottawa at Home magazine, profiling citizens working to make their community better for all, and serves on the boards of the Writers' Trust of Canada, Care Canada, and Care International in Kenya. Catherine, thanks for accepting to moderate the panel discussion today. Please go ahead, the floor is yours.
Thank you so much, Bijan. It's lovely to be a part of this conversation today. I appreciate the invitation, and a warm hello to all of you who are joining us from across Canada. I'm delighted to welcome you to what we hope will be a spirited conversation about the impact of COVID-19 on Canada's foreign policy. It has certainly been a busy day already. We've literally just seen the tail end of the speech from the throne, and the Prime Minister will also be addressing the nation a bit later on today, so there's lots making news, and we're grateful that you've chosen to set aside time for this discussion, although of course, where would you rather be? Let's be honest. We have a distinguished panel of experts who are here to lend us their thoughts and their opinions about the path forward, and it is my distinct pleasure to introduce those panelists now. The Honorable Sergio Marchi is Canada's former ambassador to the World Trade Organization and the United Nations in Geneva, and served as the commissioner on the UN Global Commission on International Migration. Mr. Marchi served many years as a member of parliament and as a cabinet minister in 3 critical portfolios within the federal government: international trade, the environment, and citizenship and immigration. And he is the immediate past president and CEO of the Canadian Electricity Association. We're delighted to have you with us, sir.
Thank you, Catherine.
Dr. Erica Di Ruggiero is the director of the Center for Global Health and associate professor at the University of Toronto's Dalla Lana School of Public Health, where her research examines how evidence affects global policy agendas related to employment, other determinants, and health equity in the context of the Sustainable Development Goals. Her work addresses governance-related questions about the roles of public-private partnerships and global institutions in the promotion of health equity, and the prevention of non-communicable disease and related risk factors. Welcome.
Thanks so much, Catherine.
And Mr. Wesley Wark is a senior fellow at the Center for International Governance Innovation and has previously served 2 terms on the Prime Minister of Canada's Advisory Council on National Security and on the Advisory Council to the President of the Canada Border Services Agency. Most recently, he provided advice to the Minister of Public Safety on national security legislation and policy. Welcome to you.
Thank you, Catherine. Hello.
Well, I do have several questions for the 3 of you, but I also hope that our audience will be equally engaged and that they will contribute some questions as well. So I encourage our audience to, by all means, use the Q&A function at the bottom of the screen to submit questions that you may have, and we'll try to get to those questions as we go along in our discussion. And of course, our guests are all pros at these kinds of conversations. So what we're going to do is try to keep our answers relatively short, but extremely informative so that we can get to as many questions as possible during the hour. We recognize people have tight schedules, so we're going to have a hard stop at 4 o'clock today. But on that note, I do have a question which I hope can set the stage for this conversation and which all three of our panelists can react to individually. And it's a pretty basic question. It's also extremely important. How does Canada's foreign policy strategy need to change to address the challenges we're facing with this COVID-19 pandemic? It's pretty much the basis for the conversation. And Mr. Marchi, I'd like to start with you if you don't mind.
Sure. Thank you for having me. Thanks to the organizers, and obviously a natural first question. It's been a huge national challenge, and most of the solutions have come from national and subnational governments. But because the pandemic is global, on the foreign policy front, I believe that Canada has to be a lot more active and a lot more engaged bilaterally with our partners, as well as at the UN and in the various global fora that we are members of. So some priorities would be, how can we encourage more cooperation and collaboration internationally? I don't think there's been as much as I think the crisis called for. Do we need new specific mechanisms in order to accomplish that? How do we ensure when we have a vaccine that it's distributed fairly and thoroughly across the globe, developed and developing countries? How can we encourage more shared and collective R&D where we can leverage the strength and resources of the many? And perhaps more importantly, what lessons should we draw from this pandemic that will serve us to better protect ourselves against the future crisis? And this must include, I believe, a fulsome review and discussion of how the United Nations comported itself, because I happen to believe that it was slightly underwhelming. Most of the actions, as I said, came from national and subnational governments as opposed to global institutions. The Secretary General was not as visible as I think he should have been. And while the Security Council during the Ebola crisis designated it as a, quote, threat to peace and security, end of quote, which gave it a force of international law, they didn't do this for COVID, despite the fact of a greater devastation. And I'm not sure the reasons why, but we should find out. I think the review should also include how China behaved at the outstart in concealing the threat, as well as the immediate response thereafter from the WHO. If we're to be more successful in combating the next pandemic enemy, we need to be thorough, which means openly asking the sensitive questions that need to be asked. I don't think we can be overly diplomatic and sweep things under the rug. At the same time, I think the Secretary General needs to call a special sessions where all of these questions will be addressed. I think as a country, we should insist that this happens. We should also call for specific recommendations to flow from this session so that governments across the world can take the tangible and necessary actions required in terms of better preparing themselves. And we should also make sure that the developing countries are ready. Do we need a transfer of technologies from developed countries? Do they need financial assistance? Because we don't want any disproportionate numbers of cases and victims, unfortunately, to only come from the developing world. So there's much to do on the global stage, but I think we need to be a little more assertive and a little more active.
Thanks very much, Mr. Marchi. It's going to be a very interesting discussion. Those are some excellent points and a good way to get this conversation rolling. And Dr. Ruggiero, I'd welcome your thoughts now on the same question.
Yeah, so thanks for the opportunity. I mean, just to situate my perspective, and as you heard in my introduction, my background's really in global public health policy and really how health policy intersects with development and some of the decisions we make as part of our foreign policy. I think it goes without saying that COVID has really underscored its relevance to any foreign policy agenda. But I think it's also important to bear in mind that health has not always been central to foreign policy strategies, even though it's been used as a political instrument to promote peace, security, and prosperity. So I think the short answer to your question is, yes, the policy does need to change. My understanding is that a proper review of our foreign policy hasn't really occurred in some decades. I'd welcome my co-panelist to comment on why that might be. And of course, policies aside and politics aside around election timeframes and the global context we're in, I think one of the main reasons we do need to rethink it beyond COVID, and I'm going to actually center my remarks on not just what's happening during COVID, but pre-COVID, because COVID has really been an inflection point for surfacing things we've already known about the health of societies. One of them is actually embedded in the 17 Sustainable Development Goals that over 192 countries signed on to. And the importance of that agenda, apart from its boldness, is that all countries are on the hook for it. Its predecessor was very much oriented to only putting the burden on developing countries. And I think that's not the way to go. We live in a very globalized world and very interconnected, and COVID-19 has really underscored that point. I think the other thing is that we need to sort of take a hard look, I would agree with my colleague, in Canada's foreign policy and what it's typically included. So we, on the one hand, have purported to advocate for the promotion of human rights. This government has a strong focus on gender equality, but what are we actually doing about those things here at home? And which leads me to my final point, which is there's a bit of a disconnect, I think, also between what we say in our foreign policy and what we're doing here domestically. And so it's not always very well aligned. And I think COVID-19 has certainly underscored that. So to summarize, I would say it definitely needs to change. And one of the things that hasn't been said yet that I just want to bring to the forefront is that Canadians need to have a voice in this foreign policy. Many lives and livelihoods have been profoundly impacted by COVID-19. And we need to put a face on what appears to be a faceless policy process. And we need to, and these are fundamental principles to democracy. And we need to be hearing also from communities that are disproportionately affected and marginalized. And this was, again, before COVID-19. And COVID-19 is not the great equalizer. It's actually further surfaced some of the many inequities that are embedded in many of our societies, including our own.
Thank you very much, Dr. Di Ruggiero. Excellent points, important points. And I think that that is one thing that we can certainly all agree on, is this idea that, that COVID really has revealed to us the immense holes that exist in society at all levels. And it's forced all of us to think about how we can do things differently moving forward, which of course is partly why we're here today. And I really appreciate that all of the panelists have different expertise to bring to the table. And so, Mr. Wark, we'll turn things over to you to answer the question about how Canada's foreign policy strategy needs to change to address the challenges we're facing with COVID-19.
Catherine, thanks. I'll be as brief as I can, and again, offer my thanks as well to the organizers of this event to tackle this important topic when there's so much on everybody's minds. It is important to continue to think about Canadian foreign policy and where it should go in the future. I think COVID has posed immense challenges for the conduct of Canadian foreign policy and raised many new issues. So let me just list some of these without this list being comprehensive. One thing is that the WHO, the World Health Organization, is the UN body in charge of trying to bring about what could be called collective security for global health. Now, the WHO has faced a lot of criticisms in the context of its response to COVID-19. I don't think all of those criticisms were necessarily warranted or very nuanced or very understanding of the situation that the WHO operates within. That aside, I think one of the things I would say about Canadian foreign policy is that it's time to take a stand on the WHO. Do we support it or do we not? And not sit on the fence on that one. A second major challenge for Canada is geopolitical, in the sense that we've seen a very disappointing, to put it mildly, response in the United States, both domestically and internationally, to COVID. And this, I think, forces Canada to think about the nature of its very close ties to the United States and its dependency on the United States as it kind of tries to reorient itself in the world. Similarly, the China question comes up, and we are in a period of very deep freeze ties to China at the moment, which aren't certainly helpful in the context of trying to navigate our way through COVID-19. And that includes issues such as we've come to discover, the vulnerability of supply chains for Canada and for many other countries, including around the global supply of personal protective equipment, so-called PPE, which is so vital for frontline workers. So, if someone had said a year ago that Canadian foreign policy should take a close look at supply chains, they'd have everybody's head shaking. But this is an important new issue going forward. Another, disquieting thing we've seen in the context of COVID is the rise of state-sponsored disinformation and misinformation campaigns, and in fact stepped up espionage efforts, all targeted in some way or another at the COVID problem, whether it's trying to distort the reality of the situation, or try to steal intellectual property, or disrupt other nations' preparations. This is a level of information warfare and propaganda that has risen, I think, to new heights in Canada. I think has to take a serious look at and see what instruments it has. The final thing I would say, and this kind of echoes Sergio's comments, I think is Sergi's comments, sorry, is that Canada really needs not only to think about how it can reinforce the international system, but also about how it can work with like-minded countries and the variety of multilateral platforms that I think could have been much better used in COVID, whether it was G7, G20, the Global Health Security Initiative, which don't really seem to have come into play. And there may be lessons for the future in that regard. Thanks.
Yeah, those are fascinating comments. And I'd actually like to build on the final comment, because Mr. Marchi also mentioned this in his opening remarks with regards to broadening our efforts to strengthen global governance through our membership in other international organizations. And in fact, Mr. Marchi, you wrote an article along with Alan Rock stating that you thought we needed to rethink our foreign policy along those lines. Why do you think that broadening outside of traditional organizations like the UN is the right approach?
I'd say three things to that. First of all, we need to clarify and renew our priorities. I think Erica mentioned moments ago that it's been decades since a proper review of the foreign policy. And there is a sense in the country that the Liberal government has been freewheeling when it comes to foreign policy, as opposed to being guided by a focused strategy of priorities and alliances, because you can't be everything to everyone. And I think that this exercise should not be led by the Prime Minister or the Foreign Minister. I would create and propose that they create an all-party parliamentary committee composed of both House and Senate members. There are many qualified in both houses, and they should be permitted to openly consider all the salient issues and ideas and come forward with specific recommendations for the next attack or the next coronavirus. I also think that the bonus or the benefit during a minority parliament is the process of turning to an all-party committee. This would, I think, be well received by the opposition parties. Secondly, I think we need to reinvest in Canada's foreign policy infrastructure. Unfortunately, the department has been a very popular place to turn to when they need savings. The net result is that budgets have been slashed continuously, both under conservative and liberal regimes. And I don't think this is sustainable, because if we want to have a robust, meaningful foreign policy, then we cannot approach the world on the cheap, because actions speak louder than intentions. Finally, I think Canada should use its membership in the different critical global clubs to strengthen multilateralism, as Wesley just finished saying. And I think COVID can help us, because we're all in this together and we all face the same threat. And from that, there should be an appreciation for the collective public good. And multilateralism needs the help of countries and like-minded countries like Canada, because it's become a dirty word to many leaders and governments, starting with our neighbor to the south. The world cannot be set right without collective, coordinated action. We are interconnected, and we should start acting as if we are.
One of the things I wonder, though, is that in terms of multilateralism, and Ms. Wark, I'm just going to turn back to you for a quick answer on this, or maybe not so quick, but the fact of the matter is that we are seeing a rise of nationalism, and we are seeing situations where COVID may or may not be bringing the world closer together. How do we encourage multilateralism in that context?
It's an excellent question, Catherine, and certainly the trend is there. I think we all hope that the trend will never become overwhelming. There will always be regimes that reach out for kind of nationalist or authoritarian policies over time. I think the challenge is really to decide where your efforts can be best put. And I would just echo Sergio's excellent comment that if Canada is serious about foreign policy, it has to be serious about investing in it. And that means kind of restoring what we now call Global Affairs Canada to a position of strength in terms of talent and resources and global reach as well. This is one of the things I think that COVID has taught us. It's not always that Canada needs to know the world fully well and extensively. COVID has shown us that we need to have a really strong appreciation and in-depth knowledge of the globe. And this requires, a strong input from foreign service officers around the world and a lot of political reporting in addition to the other things that they do. But on the multilateral question, there are lots of options and alternatives. And I think that the challenge is for Canada to decide, which is a talking shop and which is a place where real action and responses and policies can be framed. And we're perhaps too used to treating multilateral organizations as talking shops as opposed to sources of action. There have been interesting suggestions, for example, that the Five Eyes intelligence partnership, which is becoming more and more a political and economic partnership between those countries, Canada, US, UK, Australia, New Zealand, could be a new kind of multilateral forum for dealing with issues like COVID and pandemic and global health security. That's something worth exploring. I think it has its drawbacks and limitations. There is the G7, but the G7, like the Five Eyes, suffers from its limits in terms of representation and membership. There is the G20, which from my perspective at least, and perhaps Sergio and others on the panel will have a different perspective, it has always been more of a glorious idea than an ambition realized. But the G20 at least has the benefit of a more diverse and globalized membership. And I would look to the G20 as a place to kind of revitalize, I think, multilateralism on the political and foreign policy side of things. And I would hope, because the idea of G20 really in some ways was a Canadian idea way back when, and I can remember some of those initial conversations. Let's get back into that and see if we can revitalize it, because I think Sergio is absolutely right that there is going to be a need for Canadian and other like-minded countries like Canada. It's going to be a need for our leadership. We're not going to be able to rely on the old leaders of the global system, and particularly not going to be able to rely, alas, on the United States.
Dr. Ruggiero, one of the elements of a strong foreign policy does revolve around the issue of global public health, or at least supporting it. And you've talked in the past about global health diplomacy. Can you tell us what that is and why you think Canada should pursue it, what you think we can even achieve by adopting global health diplomacy?
Yeah, and so thanks for the question. Just to pick up on the other two panelists in terms of where Canada actually could demonstrate some moral and also political leadership is in this arena, but also in areas where we actually have been strongly arguing for universal health coverage. I think this is a good example of how we are different from our neighbor to the south. And now more than ever, COVID-19 has really underscored the importance of strong health systems. A vaccine, if and when it does arrive on the scene, is not going to be a magic bullet, and it won't actually be sufficient without strong health systems that can deliver it to the people who need it the most. And I think this is an area where Canada has actually shown. So just back to your question, this could be an area that we can actually explore in global health diplomacy. And of course, diplomacy is not a new term. It's existed for many centuries, but it's certainly come into the literature in recent years and has really become part of the system of global governance. And as my colleagues on the panel have already argued, the context for global health is so much more complex than it was, even a few decades ago. We have public, private, and nonprofit actors who are really shaping what it means to actually have a position. And all of these actors are competing for attention and resources. Back to the WHO, for example, it's chronically underfunded. Yes, we expect a very tall order in terms of its ability to lead by example. If you look at its funding model, I think only very few countries actually fund it. And the Gates Foundation is actually quite prevalent in terms of its resources. So, people may have opinions about that either way, but I think this is an example of how some of our global institutions are challenged in part by how they're resourced and what they're expected to do. And so these are the kinds of, I think, important discussions we need to be having, and what do these strong institutions need to look like? And I would echo what's already been said around multilateralism, because I think it's being more contested now than ever. And in some areas, like in the case of vaccines for COVID-19, we do need greater global solidarity, but what we've actually started to see is a lot more nationalism and protectionism and regionalism when it comes to buying out and buying off a vaccine that doesn't even exist yet and is still being tried. And so I think these are some of the principles that can be reinforced in terms of relationship building and negotiation processes. And of course, as a university and as a school of public health, we felt that we could take up this challenge and are working closely with the Office of International Affairs and trying to engage many former and current diplomats in partnership with the Geneva Institute to develop training and a community of practice so that we have a cadre of people working in global health diplomacy to strengthen our positions. This is an area, that is not completely well addressed in many academic programs, and since we need to kind of stick to our mission as well as a university, this was an area that we felt that could require some more training and capacity. It's not a panacea, but it's certainly something we felt we could contribute to.
Thanks very much. And, I was going to follow up on some comments that have been made earlier with regards to the relationship between our neighbor to the south and the tension that has existed there for past few years now, but it's certainly still very present. But we have a question from the audience that encapsulates some of that question. So I'm going to go to that first. There are a couple of questions within this, but it's all the same theme. The Trump administration has not been kind to Canada. If Joe Biden wins in November, what changes should we expect in Canada-US relations? And what should we expect to remain the same? What opportunities on the world stage do you think will emerge for Canada in a possible Biden administration? Those are a lot of what ifs. And Mr. Marchi, I know you're generally trained not to answer the what if questions, but are you willing to tackle this one and give us your thoughts?
Absolutely. I don't need to get reelected anymore.
Okay.
The last 4 years of Mr. Trump's first term have been trying, to say the least. Between him being unpredictable and bullying, and the fact that he's treated other allies in the same vein, our relationship has hit new lows. Not that we've always gotten along and not that we're always on the same page, but we've always had a relationship for the most part. I mean, there was the John F. Kennedy, Diefenbaker years that didn't work as well as the Mulrooney Bush and the Mulrooney Reagan years, or the Crutch and Clinton years. But we've largely been able to resolve our differences thoughtfully. We are neighbors, we are allies, we are great commercial partners, so there's much at stake, particularly for us as the junior partner. I think the prospect of a Joe Biden presidency doesn't suggest perfection, but it does offer the opportunity of resetting this relationship that has gone astray because of President Trump. I also think that Biden will have to play to his political circumstances as we will. So it's not always going to be easy. But I believe that Mr. Biden has two great strengths. One is his experience. He's been around the track. He's been vice president. He knows Canada well. One of his last trips as vice president was to Canada, which signaled the importance that he has for this country. His vice presidential candidate studied in Montreal. So I think between experience and knowledge of Canada, Biden offers the potential to go back to the storied friendship. The second thing is that he's decent. He's a decent soul that respects allies, generally speaking, and respects processes and traditions. So while he will have his political agenda, I think he will be able to rebuild those kinds of bridges. The one issue that I'm worried about is trade. We've seen how Trump has played hardball on the renegotiation of NAFTA. We see how irresponsible he's been with throwing tariffs around. And for Joe Biden, again, I think we'll be able to resolve most of our disputes thoughtfully, but he will be beholden to a Democratic Party that isn't exactly friendly to free trade agreements, particularly the emboldened left of center young bucks in the party. So I think we will still have to guard ourselves, particularly on the trade front. But I think if Biden comes in, it's certainly going to be a marked improvement over the last 4 years. I don't think we can get any worse except with a second Trump mandate.
Yes, I think we've gotten used to saying it can't get any worse than this and then continuing to plumb the depths. But, building on the relationship front, though, another one of the relationships that has been difficult, and partly because of the United States, is our relationship with China. So where do we go, Mr. Wark, with that relationship moving forward? How do we ensure that if there is some hope that the Canada-US relationship could, with a Biden presidency, be revived to positive levels, what about China?
I mean, that's a very difficult question, Catherine, and I don't think anybody has a real answer to that at this stage. I've long felt that one of the things that Canada has to work very hard on with regard to its relations with China is trying to change the Chinese perception of Canada. And by that, I don't mean the Chinese people's perception of Canada. I mean the Chinese government and Communist Party's perception of China. What is that perception? It's been strengthened by the Hmong affair, of course, and strengthened by other kinds of issues that the Chinese like to put in the same basket. Basically, it sees Canada as simply a cat's paw, a minor and annoying ally of the United States. It doesn't see Canada as we see us, as a middle power with global interests and an independent tradition of foreign policy and political decision making. It's not easy to change a country's mind about another country, but that is something where behind the scenes diplomacy and the maximum number of points of contact may over time have a difference. Until we can change the Chinese government's view of Canada, we are stuck in this deep freeze. And I think the second thing that has to be said about this is that we are inevitably being dragged in the wake of an American trade war with China on technology and many other kinds of fronts. And I don't see that trade war diminishing in ferocity very much, no matter what the outcome of the presidential election is. So we're going to have to weather some storms there. But the biggest thing I think that Canada can do, and it's not an easy thing to score political points for in a public debate, of course, is simply keep working at every opportunity to change the official Chinese perception of Canada, which is one of the great contributors to the problems that we currently have with that country.
Could I add a comment, Catherine, with respect to Erica, who's next in the lineup? There's no question that China, with its enhanced power, has become much, much more belligerent, certainly with respect to Canada on a number of fronts. And I agree with Wesley, we need to change the behavior of this giant. But speaking frankly, I think our size has not allowed us, quite frankly, to change their perception or that behavior. And one of the things that we may now have to contemplate is mobilizing a Western coalition to deal with China just the way we did with the old Soviet Empire during the Cold War. It'll be a different context, and we will need a different president than Donald Trump to lead it. But I'm thinking that more and more our size is unable to change this giant. So what about contemplating a coalition, which Canada would be part of, and which we can leverage that strength vis-a-vis our individual items? It's an issue that perhaps its time has come.
Dr. Ruggiero, you are indeed next in the queue. Did you want to add comments to anything that Mr. Wark or Mr. Marchi?
Well, I mean, I would agree with what's been said. I mean, I think the other interesting thing about our relationship with China, when you think about the different institutions that interact, we have a number of students who are from China who are in our academic institutions. We have actually many partnerships in research that are leveraged, but that's very different from the geopolitical discussion that you both have just been alluding to. And so, but those continue in spite of that, a little bit under the radar, but are certainly increasingly challenged by those opportunities for collaboration. And I think, again, because of where COVID first started, I think that collaboration between scientists and medical professionals was instrumental in getting the word out so that speedy action could be taken. So that's, I think, all I'll say on that point. I think it's a very thorny and challenging issue, and I would agree about the coalition approach as well. I mean, I think we also have very strong ties to sub-Saharan Africa, and it also is being directly influenced by Chinese investments. And so, you know, it's a complicated world we live in, and so I think there are many facets to this. We could have a whole session on this topic.
Well, one of the things that I have wanted to specifically ask you about is the fact that COVID-19 has really proved to be a very gendered crisis, and there has been a direct impact on women's economic independence. That's something that we've seen in Canada. It's something that we've seen around the world. And I wonder what we as a country, and we have a self-declared feminist foreign policy, what we need to do to ensure that women's economic and health recovery is front and center, both here at home and around the world.
Yeah, well, I really appreciate the opportunity to comment on yet another really complicated topic, but I actually think it speaks to a comment I made in response to your very first question about a potential disconnect between what we espouse in our foreign policy and as part of the Sustainable Development Goal agenda and what's happening here at home. And let me just be very explicit that actually my perspective is very much influenced by a researcher who actually looks at the gender dimensions of employment conditions, but I'm also a mother and I'm a caregiver of an older parent. And what COVID has helped to show is that there are disproportionate impacts on different parts of the population, and that it is not the great equalizer. Just, you know, I think it's important to say that, again, this is not a new issue. Women are even more vulnerable in health terms during times of crisis. We've seen this from past pandemics. We also know that more than 70% of the health workforce is made up of women, and therefore they're at greater risk of contracting the virus because of the roles they play, and so therefore their economic well-being is under threat. I mean, I'm sure some of you have already heard this phrase that's been coined early on in the pandemic, which was that we may be entering a she-cession, which is a play on recession, partly because Canada's employment, even just in the early days of the pandemic back in March in Canada, we saw over 1 million jobs lost, and many of them were female-dominated service sector jobs. And they were the first to disappear for all the reasons we know, but many of those jobs were precarious to begin with. They were part-time, they lacked benefits or job security. And so as the pandemic starts to escalate, and as we were discussing before this, and schools may close, what kind of supports are we putting in place to help support women And so I think this is an area, again, that Canada could exercise great leadership and actually start doing some things at home. So before the pandemic, women were paid on average 70% on the dollar. I don't know if any of you saw the article yesterday that was published on the 22nd of September that said that women are working for free for the rest of the calendar year. It was a bit of a tongue-in-cheek way to demonstrate the 70 cents on the dollar pay inequity at the average level. And so I think that's one issue that needs to be seriously addressed here at home. And secondly, it's also in the kind of research that's done. So many of these public health measures that are being put in place, how are they disproportionately affecting women and women of color and other marginalized communities? What kind of policies are being put in place by workplaces to support for childcare, elder care? What kind of gender impacts are we seeing on the different economic and social policies that governments are, inevitably experimenting with to counter the effects of COVID? And so there's no one magic bullet, but I think these are some of the areas that we could be doing better in and could lead by example.
Yeah, excellent points. And an ongoing issue. I mean, it's been an issue in the past, it continues to be an issue, but certainly COVID has highlighted it. We have a question from the audience, and Mr. Wark, I'm going to direct it to you. What role do you think NATO can play in addressing challenges related to the pandemic?
That's a good question, Catherine. I'm not sure that NATO has any special role. It has a theater of operations, which is primarily Europe. It has some issues with regard to that theater of operations. Probably the greatest role it can play is in terms of what I would call European regional politics and the relationship with Russia. And Russia has been a contentious and aggressive actor in COVID-19. And I think NATO can push back diplomatically and in terms of intelligence gathering and other measures just to try and keep Russia in check in terms of how it's responding and trying to take advantage internationally of the COVID crisis. In a broader sense, NATO is primarily a military alliance, and a military response to COVID is not going to be a helpful response. It does have other dimensions that can come into play. It's a helpful forum in terms of, again, discussions among member countries. But I wouldn't put NATO at the forefront if we're thinking about multilateral organizations that could play a role, either in terms of the knowledge side of this or the policy-making side. It's there in the mix, and I'm sorry if the questioner is a NATO fan, but I don't think kind of at the top of the list.
So, Mr. Marchi, you were elected several times. You've gone door to door, you've spoken with Canadians. One of the things that we've talked about in this discussion is the idea of involving Canadians in a discussion about what we do with our foreign policy and why that's important. But we're also living through a time when Canadians are profoundly impacted socially, economically, by a pandemic, and it has created all kinds of new problems. How do we go to Canadians and ask them for their advice on spending money in other parts of the world when a lot of Canadians might say, we need to focus here first?
I think it's always been a tricky balance, whether we have a pandemic or not. That will always coexist. There will always be creative tension between spending monies locally and nationally and then spending them internationally. And I think we have to do what we've tried to do in the past, and that is convince Canadians that if we don't properly address the challenges of the globe, those challenges are going to end up sooner or later at our doorstep. The refugee movement is a classic example where the world didn't really commit to a migration policy to confront that challenge. We're going to have climate change that is going to simply make things much more complicated and drive millions upon millions of climate refugees on the move. So I think we need to say that a dollar invested abroad is also a same dollar invested for our own well-being at home. We believe in multilateralism. We believe in being interconnected. It means, therefore, that we can't be indifferent to global needs. We can't pretend to live behind high walls, because those high walls don't exist, and if they do, they break down very easily in the face of global challenges. And so I think we have to appeal to Canadians' decency and reasonableness with respect to pulling our weight as a country. And the other thing is, if we don't do it as a country that's fairly well regarded, it's a license for other countries to turn a blind eye as well. So we also have to lead by example so that most countries can do the kinds of work that are required in having a globe that is just a little fair, a little more peaceful, and a little more stable.
I think part of what's interesting about that is the global element of this pandemic. And I wonder if that doesn't also contribute to Canadians thinking on a global scale as well. And Dr. De Ruggiero, one of the elements of that is the idea of a COVID vaccine, which everyone hopes is going to become available sooner rather than later. There's a lot of talk about something becoming available sometime next year. So on that note then, what can Canada do to try to ensure fair access to the vaccine, not just here at home, but also to the most vulnerable communities around the world?
Yeah, I think that's like the big question on everyone's mind, but it's also one of several major challenges in global health diplomacy that we're facing. And no country is safe from COVID-19 until everyone is protected. And I know everyone's waiting for the vaccine, but again, I just want to underscore that it's not a magic bullet, even when it does arrive, and that we need strong, robust public health and health systems to be able to deliver it. And I know I made that point earlier, but I just think that, there's this tendency to reify a technological solution to a very, very complex problem. My co-panelists have already mentioned this, and I believe I have as well, that there's this growing sense of vaccine nationalism and regionalism. We've seen countries like the US, behave in this way, hoarding a vaccine that doesn't exist yet, or trying to cut private deals. And I think many of the calls from the academic community that I'm part of and policy experts has been that now more than ever, in order to defeat COVID-19, we need greater global solidarity and not a vaccine power play, actually. And so there was a statement that many of us signed, actually, that was lending support to what's called the COVID-19 Vaccine Global Access Facility, which is really intended to, as an initiative, to provide what you just asked, which is equitable access to safe and effective vaccines. My understanding, and there are over 200 sort of being considered, and about 38, last I heard, in human trials. So we're not close there, and we should not, I think, be given the complexity of COVID, not expect a vaccine to come to market so soon and not compromise on safety and efficacy. And this is why these trials are so critical. But this call, I think, is really important. And it really is an example of what Mr. Marchi and others have commented on, which is this coalition approach and it's called the Coalition for Epidemic Preparedness Innovation, that's bringing together Gavi, the Vaccine Alliance, the WHO. And this partnership, I think, is really going to help accelerate development and manufacturing of vaccines while also ensuring those ethical standards and fair and equitable access to COVID-19 vaccines for all countries once they're licensed and approved. And I'll just say that, some countries may wonder, including wealthy ones, well, we can buy our way out of this. Why should we participate in something like this? And it's partly because this initiative, I think, really stands to help invest in a wide range of vaccines. We've seen that this virus behaves very differently and in different ways, and that no one country can do it alone. And so, for example, in terms of fair and equitable access to the developing countries, we know that 92 low and middle income countries eligible to be supported by this commitment will otherwise be shut out of access to the most promising vaccines. And if they are, COVID will continue to rear its ugly head there, and we're only as strong as our weakest link. So I think Canada is participating in these efforts. What it can do is to continue to increase, hopefully, its contributions, lobby other countries to enter in such agreements, and really to urge all WHO member states to join the COVAX initiative. And so I think this is one example that's promising and positive.
Yeah, and I wanted to change tax just a little bit, because in addition to the health elements of the pandemic, there have also been reports that early warnings about COVID-19 were ignored. And Mr. Wark, it would be really interesting to hear from you as to whether you think there was an intelligence breakdown leading up to the pandemic. And if you think there was, how do we ensure that our intelligence infrastructure is actually ready when, and I think we have to be prepared for when future health crises arise?
You got to unmute, Wesley.
Unmute. Sorry, there we go. I should
It's
know
the
better.
2020 problem.
By now, 1,000 times I've done this. Sorry, listen, I think this is an important question, and I'm glad to have a chance to address it briefly. It's a complex issue, and intelligence failure or breakdown is a bit of a loaded term. But the facts of the matter are that we created an agency in 2004 called the Public Health Agency of Canada, which was given the responsibility for conducting both domestic and global health surveillance to protect the health of Canadians. I've been doing a lot of research and writing on this, and we've recently published a digital series through the Center for International Governance Innovation on security intelligence and the global health crisis. I think it is uncontrovertible that Canada suffered a serious failure of early warning with regard to the outbreak of COVID in China and its progress globally. And by that, I mean really two things. One is that we were unable to use the information sources at our disposal well to fully appreciate the threat posed by COVID-19. And I say that despite, recognizing that COVID is a new kind of disease and it had its surprises and continues to have its surprises. But I think there was a very, very serious failure of early warning, which we need to address. And in combination with that, not only did we fail to appreciate and use well the sources of information that we had, some of which were very innovative platforms, including something called the Global Public Health Intelligence Network, but we failed fundamentally in terms of doing risk assessments, which is basically the business of taking the information that might come to you from official sources and unofficial sources, the media and so on, in a kind of global intake, and making sense of that and reaching a conclusion about just how dangerous is COVID-19 and when. We have the record on Canadian threat assessments produced by PHAC from early January through to mid-March. And that record is that Canadian Public Health Agency of Canada officials continued to believe, continued to say, continued to tell decision makers that the risk to Canada from COVID-19 was low from January 15th to March 16th. That was a terrible failure of judgment. And I think we have to look at the system. I'm not blaming individuals for this. We have to look at the system that produced such bad threat assessments. And part of the problem there is the Public Health Agency of Canada was completely disassociated from any other element of our security and intelligence community. So it couldn't go out and ask for assistance from any other foreign intelligence gathering agency in Canada, whether it's Communications Security Establishment, Global Affairs, or anybody else. It couldn't tap into what they knew or might know about COVID-19. They were on their own, and that siloed approach, I think, has to change, and there has to be some serious consideration given to the idea that pandemics in the future and other biosecurity threats are also national security threats and have to be taken seriously, and we have to have a strong institutional capacity to deal with them.
So as we creep towards the 4 o'clock hour, I want to turn to a question again from the audience that reads, both Mr. Marchi and Mr. Wark suggested that we should change China's position on Canada or their perception of Canada. How can we achieve this to be able to have constructive discussions with the government in Beijing? Right now, as both panelists said, China looks at us only as a US ally that does as the US dictates. Mr. Marchi, did you want to address that?
Yeah, there was a great potential when Mr. Trudeau was elected in 2015. The Chinese actually initiated an invite for him to go to China and to talk, among other things, a free trade agreement. And that came because his father, Pierre Elliott Trudeau, was the Canadian Prime Minister who opened diplomatic relations with the Chinese. And it came after a cool time when Mr. Harper was a little harsh on China. But the China of 2015 is no longer the China of 2020, in my estimation. As I said before, they've become increasingly belligerent. They've kidnapped essentially 2 of our citizens for obviously unfair, retaliatory reasons. And we've been holding on to our principle for the extradition treaty. We're the meat in this American-Chinese sandwich, unfortunately, and nothing that we've been able to do on our own has worked. So I go back to how can we leverage a broader coalition to perhaps tame the belligerent giant somewhat. Secondly, also our dependency on them, and they become the factory for the globe. But we've seen, for instance, during the pandemic when they shipped us 1 million masks that were defective. We've seen Trump not wanting to share N95 masks with Canada. And that has led not so much to the Prime Minister, who has played overly diplomatic in the face of these threats, but premiers like the Premier of Ontario, Doug Ford, saying we need to be able to repatriate a certain amount of our manufacturing. We need to produce PPEs here, for example. We need to produce more things rather than shipping our resources and then importing finished products. But for that to work, the Canadian consumer has to participate. In other words, is the Canadian consumer prepared now, after going through this pandemic, we're still in it, but after seeing what can play out, are they prepared to pay an extra dollar for a Canadian-made or a North American-made product rather than going to the department stores where most of the products are Asia, led by China? If the consumer is prepared to make the transition, then I think we can repatriate manufacturing and be less at the beck and call when these crises mount. If the consumer doesn't change, I think it'll be more of the same.
Okay, this is a really dangerous thing to do with 1.5 minutes left, but I'm going to ask a question about supply chains to Mr. Wark, because, and we really do have about 1 minute left. How can we address the vulnerabilities that have been identified in global supply chains? I mean, you mentioned it off the top in terms of PPE, but also just in terms of trade in general.
Thank you for that question. I'm going to try and be as brief as I can. I mean, first thing,
You've now got 40 seconds, Wesley.
There we go. I've already wasted 2.5. So the first thing I think I'd say would just be, with all due respect to Sergio, I can't imagine a future global economy in which a country like Canada could decouple essentially from China, even if that is an approach that the United States is increasingly talking about rhetorically. In terms of supply chains, the particular question, we can't secure all supply chains. We can't reshore everything in Canada. What we can do, I think, but this will be a complex undertaking. It'll take a lot of smart people around a table to really come up with this. We can decide what are the elements of what we call critical infrastructure that we really have to ensure that we have a good handle on supply chains, and we have some Canadian capacity for independent manufacturing and contribution to. What are those critical infrastructure pieces of the broader supply chain problem where Canada can really have greater control than we've attempted to exercise in the past? And that can be around things like telecommunications, energy supply and transmission. It can be around some innovative technologies like artificial intelligence, quantum computing. It'll have to be a sectoral approach, and it'll be messy and complex, but that's the way to go, to decide what we're good at and what we can really try and establish and secure in Canada as we face a retreat from globalization. Not a decoupling, but certainly a retreat from globalization.
And for the record, I'm not advocating, Wesley, decoupling, but I am advocating intelligent de-risking.
Yes, good point.
Dr. Di Ruggiero, it's only fair to give you a couple of seconds here to respond.
I mean, this is not my area, but I would just add that I think research needs to be actually better aligned with some of the priorities that Wesley has already talked about, so that our innovation agendas are fed by the best possible science as well. So that's all I'll add. Thank you.
I'm very grateful to all three of you for taking the time to be a part of this conversation today. It's certainly an ongoing discussion. We have had an excellent and an engaged audience, and I want to thank the Institute for Peace and Diplomacy as well for hosting the conversation. I wish each and every one of you an excellent remainder of your day. Thank you again.
Thank you, Catherine.
Thank you.